we will be vulnerable in the same way if we rely on certain foreign technology that allows others to have access to our technology or our information. Now, I'm not a technologist to tell the group how that's done. I just know that it's a vulnerability. And we also need redundant systems. We need interoperability and we need redundant systems. And if we go totally with one, we're vulnerable. Now, to your other point, many people are old enough to remember health stories in the news about herpes. And this was front and center for a while, and all of a sudden, AIDS hit. To which I said, as a former journalist, what, did we cure herpes? Is that no longer an issue? And of course it was, but that's what the daily newspaper is like, and that's also what, frankly, academic research is like. You get research grants to study a particular thing. So one day the pandemic will be over, and we will be back to industrial policy and jobs and unemployment and the supply chain and climate change and all those other things. You bet.
Yeah, I was just going to ask, Alan has been very involved with a project on risk analysis and communication with Johns Hopkins. I'm just wondering if you want to discuss that a little bit, especially your work with epidemiologists to better communicate their findings, to try and communicate more clearly and glitches and to try and have better compliance.
Yeah. Well, I think that's an important topic, and I did get a call from Johns Hopkins, and I was very flattered. I mean, naturally, I thought it was a wrong number at first, and then no, it turns out they really did want to speak with me, because I've been studying risk communication for about 35 years. Risk communication is sometimes described as conveying information about risk to human health to a lay audience and causing them to act in a certain way. And I was surprised when I read 100 urban emergency plans from all over the English-speaking world, Australia, New Zealand, UK, America, Canada, that the words risk communication were not in any plan whatsoever. Pandemic, I think, was in one, and public transit was in 3 or 4. So you can imagine the implications in trying to get people to do things or not do things or evacuate or stay put when you don't raise these topics whatsoever. This fixation of mine dovetailed with Johns Hopkins epidemiologists who are worried about the continuation of the profession, because you have heard people saying, and you have read news reports calling the epidemiological work a hoax. We've seen Neil Ferguson in the UK lose his job because he was supporting a shelter-in-place order and yet had his lover visit him a couple of times across town. We've seen projections of anywhere between 38,000 and 2.5 million deaths in America. Well, when you have such a broad range, you've essentially said nothing. And when you read the academic research that says, well, we didn't control for gender or age or pre-existing conditions or ethnicity or this, well, then you have almost nothing. You might as well just say it depends. So there's a new branch of epidemiology developing called consequentialist epidemiology, which simply means what is the consequence of what you are researching and recommending? Does it improve human health? And I'll give an example of that in due course. Or translational epidemiology. Does this research translate into something that is going to help human health? So let's take some of the communication during this pandemic. Don't touch your face. Okay, seems to make sense. Don't touch your face. Now remember, this is a highly educated group, but what does the average Walmart shopper think about don't touch your face? Well, why don't touch your face? No one's told anyone why not touch your face. They should be told, if you touch a surface with your finger and get the virus on your finger, it can get a free ride into the open air of your face, eye, ears, nose, and throat. Do not touch your face. But at the same time, we are telling people to sneeze into their elbows, which involves touching your face. So risk communication would say, first of all, keep it simple. Explain why. People will do things if they understand why. And then if you contradict yourself, they're at least going to question it. Now, the consequentialist portion is, would it help if someone had a Canada Council grant to study which digit, which ethnocultural, regional, and linguistic group touched which part of the face with? Is that going to help that level of research? No, it's don't touch your face. So then we end up with the mask or no mask. At first we were told no mask. Even a tremendous civil servant in the US, like Dr. Fauci, was almost mocking on 60 Minutes when he said you don't need to run all over the place with a mask on. World Health Organization said no mask, etc. Well, then we get the mask order. Well, why are we wearing the mask? Well, because it reminds you not to touch your face. Except if anyone's worn a mask, don't you find your face gets itchy and you want to touch your face? So it kind of defied normal human experience that we've all had. Then there was the debate about the coveted N95 mask versus cloth masks versus other types of masks, and maybe the mask could have the virus on the outside of it, so don't touch the outside of it. And then Governor Cuomo said, well, I'm wearing my mask to protect you, and you're wearing your mask to protect me. And I thought, I don't know him. I don't know anybody who knows him. How can I be protecting him? And then we found Dr. Fauci said, well, when we had the no mask advice, it was for two reasons. One is there was a shortage of masks and we wanted to protect healthcare workers. And the other was the data wasn't in yet. The data weren't in yet. Well, number one, that means we've got a couple of classes of citizens. Some are more important than others. And we weren't really being leveled with in that regard. And secondly, if the data weren't in, why say wear the mask? If we are in an evidence-based, data-based, science-based field and don't have data or evidence, then we shouldn't make it up. You might as well say, wear it on the top of your head like a hat, at least it'll keep the sun off, or wear it on the back of your head and walk around backwards. I mean, I'm mocking it because I think it is unconscionable to make up a prescription when you don't actually have the data. We do have data for sealing people. And then we have flatten the curve. Now, I don't know how many took geometry, but I don't know how you go about flattening a curve, especially if the curve is in the past. You have to go in the Wayback Machine, from the old cartoon, Beanie and Cecil, and flatten the curve in the past. You can't flatten the curve in the future. It will be a straight line. Now, in Euclidean geometry, a circle is a plane figure bounded by a curve, every point of which is a fixed distance from a fixed point, and a curve cannot be a circle, and it can't be flat. And I'm not much involved in flattening the curve. That is the job of health care practitioners, administrators, policy practitioners, and they need to tell me in clearer terms what they want me to do to play my role in flattening the curve, which is self-isolate, wear a mask, don't touch your face, wash your hands, how to wash your hands, etc. The slogan, flatten the curve, isn't going to work. And by the way, my late professor, Roy DeMary, used the Harvard Business Review compilation books in our courses. And you can see 50 articles which mock mission, vision, value statements. General Motors had a person who was in charge of total customer satisfaction, and anybody who's ever been anywhere near a car knows there's no such thing. So these slogans don't actually elicit the behavior or even the mental mindset that we're looking for. Flatten the curve, it wasn't it. So now we get into this risk communication research that is 50 years old. And why it's not being used, I don't know. To paraphrase Foucault, anything that is imposed from the top down is going to be opposed from the bottom up. So we have the national news conferences with Justin Trudeau. We occasionally had John Tory. We certainly had daily Donald Trump in the White House with his supporting cast of Dr. Fauci and others. What we didn't have was an immediate link to local officials. And the research says that the local medical officer of health, the Red Cross, local civic leaders and boosters, a high school science teacher, ordinary people shift workers at a meat plant, people who are opening up and getting back to work but are doing so with masks and washing hands and so on safely. Why this wasn't used, I don't know. But we didn't have that link between the big national pronouncement and the local manifestation. The risk literature, again, 50 years of peer-reviewed journal articles, say that risk is magnified under certain circumstances. The Royal Society in 1992 did a famous study of risk, saying risk is personality and context driven, meaning different things to different people at different times. There is no 9 kilopascals of risk, 4 pounds of risk, etc. So risk is magnified if it's a dread, and historically that is burning alive, chemicals, horrific diseases, and so on. If it's not understood, if it's high technology, if there are dramatic pictures, and if experts disagree. And you'll note that we have all those things in place during this pandemic, including experts disagreeing. If you can make risks voluntary, known, fair and controllable, familiar, and comparable to other risks, there's a tendency for people to accept those risks more. So in short, Wendy, and I don't think I was particularly short, but in short, the lack of harnessing the 50 years of research on getting people to do things, to change their behavior, to me has been amazing in both urban emergency plans and in this particular pandemic. And that's the subject of my new book. It's going to be called something like A Novel Pandemic: Evacuation or Quarantine, Evacuation, and Back Again, something along those lines. So I guess my two big headlines are: there's lots of blame to go around. Hospitals could have stockpiled the equipment. Experts could have helped us change behavior between SARS and now, and communicators during this particular event could be doing a better job.
Wendy, we have a number of questions I'd like to go to, if that's okay. I'd like Alan personally to come back later on, having spoken to a number of older people about the risk of with people wearing masks and who doesn't and who does. So, but I'll come back to that. From Bill, the narrative and language used to describe COVID often reverts to the specific language of war. Is this useful? Why? What is the preferred alternative language?
Well, I think that this can be seen within a context. Again, the many Harvard Business Review articles that I've read about leadership and about mergers and acquisitions use military analogies. They use, we're going to run up that hill and we're going to take no prisoners and lock and load and all this sort of stuff. And by the way, I've done a great deal of work with the military, and they don't use these terms very much. The one term that the military use all the time that I never hear in public administration or in business, in government, anywhere, I don't hear them say what the military say all the time, and that is the fog of war. And this is attributed to von Clausewitz, and he probably said fog and friction. He probably didn't actually say fog and war, but his writing is so long nobody can find out. It's like the talk film. There are things that we don't know. The weather is going to change what you can do. The demographics will change. Forecasting the future is very, very difficult. And business people and public administrators and politicians don't admit that enough. Military people do admit that all the time, and I think that's very good. Now, I'm not sure that the military analogy has helped, because if we were really to harness our experience from World War II with rationing, which maybe we should have done after 9/11, I'm not sure, or with repurposing the industrial capacity and so on, that would make some sort of sense. But simply using these terms, when you're at the end of the sentence that says this is a war, the virus is invading us, and so on, we have to mobilize. Well, okay, but what do you do then? It has to be followed up. There's nothing particularly wrong with the slogan, so long as it's followed up with something, or followed up with a request of the citizens, or a behavior required. So as a vacuous phrase, I think it serves the same purpose as all vacuous phrases.
Okay. Bill, do you want to say anything on a follow-up? Okay.
Well, just maybe, Alan, thank you. That's very helpful. But it seems like there's an expectation from the language of behavior, that there is some kind of either explicit, but more likely implicit expectation of using that kind of language. So I like your idea of follow-up. I get that. But is there not at least an implicit expectation that's being set up when that language is being used?
Well, what are we? What is the implication that this is horrific? It's difficult. There will be casualties. Is that what the war analogy means for you?
No, it's just what action is going to be required or requested of people listening to that language, especially from politicians.
I don't know. You may well be right. When George W. Bush said after 9/11, go out and shop and have a good meal and so on, this was the opposite to the war language that was used during World War II about rationing. And, there was this wonderful poster when, when you're out for a Sunday drive, you're driving with Hitler in the back seat because you're wasting gasoline. You're doing his bidding. So that didn't translate well for me, and it may have some meaning for you or some meaning for other people. It just didn't translate for me, because what do you do if you buy into that war analogy? What do you do? I suppose it could be an attention getter, and once people are, like Prince Charles, all ears, okay, what do you tell them now? So I'm still equivocal on the value of that. It could have been a paternalistic message as well. I don't think we pay enough attention to the intelligence that our mothers had. Take, for example, the epidemiologist who was asked, can a pet transmit this disease? The epidemiologist said there is no evidence that a pet can transmit the disease. And of course, one of the phrases in epidemiology is a lack of evidence does not mean the evidence of lack. In other words, so somebody didn't fund the research, so nobody published it. So it's in an obscure journal article in Australia, not the New England Journal of Medicine. This is non-information. This is a vacuous saying that you might get away with in a university classroom. There is no evidence, but it has no utility here in the real world. What would our mothers say? Put that down, Bill. You don't know where that's been. Get that out of your mouth, erring on the side of caution. So wouldn't it be obvious to paraphrase Pierre Trudeau, by the way, the average janitor who walked by a medical classroom at a third-rate community college would know that if the virus can last for 3 days on vinyl, X number of hours on leather and Y number of hours in cardboard, that it could survive on pet fur. Wouldn't that be a good guess? And err on the side of caution and say, wash your hands when you're dealing with your pet, wash your pet, keep your pet indoors, or whatever. And so I think that parental metaphor might be just as useful as the military one.
Thank you, Alan. A question from Seema. How do you see things moving forward in the fall, which is now just a couple of months away? Do you see better communication and execution of what's required in a pandemic like this?
Well, I see no reason why there would be any better communication, other than the fact that if communicators saw they weren't getting the desired result, to change the methodology, which would be a normal medical practice. I fear that people are just going to get used to this. I've been walking around downtown Toronto and I see servers with masks on serving people at sidewalk cafes, and to which I would say, I don't really need a beer that badly that I can't take back to my own condo and drink it there. If I were still living in, if anybody knows the geography in Regina, where I used to live, and I would drive south to Plentywood, Deadwood. By the way, that's where Bill Hickok was shot, and there were 4 bars in which Bill Hickok was shot in Deadwood, Montana. I guess he staggered from bar to bar just to promote patronage 100 years later. And then down to that wonderful Mount Rushmore that I just saw in North by Northwest again. I would not put my grandson in a car and take him down to that area, even though it's sparsely populated and there are no cases. Just too unforeseen. So what's going to happen in the fall, I don't know, but I think that people are going to be complacent. I don't see any. When people see these protests out on the street and there aren't mass deaths as a result, or aren't reported as a result, or you can't link future deaths to that, it's very hard to say isolate, because people have seen on television people who aren't isolating, and I think that's a real public policy problem.
Thank you. So our president, Anne Elizabeth, who does a marvelous job as president of the Harvard Club of Toronto, we're all proud to serve with her, asks, I read that half of public health is actually communication. Why is the communications, especially in Ontario, about what is okay / not okay so bad? And why is it so unclear? Can you talk a bit about that, Alan?
I think half is communication. I think that's probably a really good headline. I would say it is not good in general because it isn't taught in medical schools for the most part. Physicians think that their degrees and certifications and recertifications up on the wall are going to be the thing that gives them credibility with the patient, but I think I'm obvious when I'm saying we've had about 50 years of egalitarianism since the 60s, people who lived through the 60s, people raised by people who lived through the 60s, and we have made the error, I think, of assuming that everybody, not only is everybody equal, which is true and just, and we aren't yet at proper equality and egalitarianism, but we think that everybody's idea about everything is equal to everybody's idea about everything, and that of course isn't true. We have diminished the role of the expert. Now, what has gone well in Ontario, if I may start there, is I think all of a sudden, just like central casting arrived and took away the old Doug Ford, who was an ineffective leader and a controversial leader. They brought in the new Doug Ford, who seemed to be almost tailor-made for this emergency. Here's a guy who is sort of every man, and I once said on television that more people in Canada speak like Doug and Rob Ford than do a newscaster or a professor. And, you know, I've heard people speak this way in places like Parsboro, Nova Scotia, and Plentywood, Montana, and what have you. At any rate, he seemed to be tailor-made for this. He gets on his mask, gets on his gloves, goes and gets a carton full of masks, and so his version of populism is to say, I want more testing, and so on and so forth. What I don't think has worked is that we've treated the province the same, and it isn't. There are different manifestations in different places. I know of one grocery store outside of town where when you walk in, you are given a buggy, whether you are only buying a toothpick or not, you are given a buggy. So that keeps you 6 feet away from people. The buggy is sterilized, your hands are sterilized, there's a certain number of people in the store, etc. In the LCBO, which I suspect the province can control, you either have somebody standing at the door talking to you, you have a bottle of sanitizer, you have a lineup, you don't have a lineup. No two stores seem to be the same, so we really don't have a protocol with which to do this. And that's a problem because people will then say, well, do they know or do they not know? And which is the right route to go? So that kind of standardization is probably the thing that I would point to the most. If that was from Elizabeth, I hope that's a decent answer for you.
I'd like to follow up, Alan, with going back to your whole risk issue. And we've heard a number of people on various platforms talk about risk management, risk aversion. I was recently on a call with a number of YPOers over the age of 50, and the age is relevant. They're all in their early 60s. And everyone felt really angry at the issue about people wearing masks. Why do you go to a Longo's and you have to wear a mask? You don't have to at Home Depot. Many young people are not wearing masks at all, which in some ways frightens older people when I've spoken to them. And so it goes back to this whole issue of even the mathematics of risk. If you have 20, 30 years, 40 years to live and you're in the stock market, it's different than if you're retired and you think you've got 15 years to continue. How do you deal with that whole issue of risk, how the government needs to communicate risk? Or is it better to just allow things to be a free-for-all and let people make their own decisions based on their own risk profile and self-awareness?
Well, it's funny. I'm over here on this side of my camera. It's still the real world. I'm not living in a fantasy here. And I am aware that we've had about 50 years of a discourse that says, let's get government out of our lives and people know best. And we've had a Supreme Court ruling in Canada on so-called subsidiarity, where the local government is best to handle things. I think a lot of that is nonsense, to tell you the truth. I think that it is government scientists and meteorologists and physicians and researchers and government money that has funded the research and so on that has determined all this stuff, the risk or the likelihood or the propensity or what have you. And I think governments need to play a larger role because, as has been said, there was a Royal Commission on staying in place during brush fires in Australia. And, in America, they evacuated 300,000 people from California. In Australia, a lot of people stay and try to defend their homes. And the Royal Commission said, we are really asking people to go into fire situations that are so dangerous we wouldn't send our most experienced firefighters into them. So I think egalitarian is fine and empowerment is fine and letting people decide their own fate. And by the way, I'm also in favor of democracy. But delegating to the average person a decision that they have no expertise to help them decide, I think is mad. And I see this even at my dentist's office. I'm going to do this, that, and the other. What do you think? And I say, well, I'm not a dentist. How would I know? If this is a necessary thing to do, I think we should do it. But my weighing in on something I know nothing about, and I'm a consultant and a former journalist, so I'm often happy to talk about things I know nothing about. But you've got to draw a line somewhere. I'm not sure how much you can legislate any of this. Anyone who takes Vanity Fair will see a great article about Governor Cuomo in there, and he said, look, the fact that there were a couple of cases in California, that means nothing. Nobody can care less in New York. This is New York. And I had no power to require people to do some of these things. So I'm empathetic with that, and Wendy can weigh in on that public policy challenge as well. But we can legislate certain things that don't infringe on civil liberties, it seems to me, Rick. Why can't we get rid of this just-in-time delivery that will kill people? When you buy a hamburger at a fast food outlet, the computer tells somebody up in the supply chain, we need another hamburger. You don't get it until you're about 90% out of hamburgers. So why can't we legislate that not only do fast food outlets need to keep 100% supply on hand at all times, but so do stadia, so that if everybody goes to Rogers Stadium in an evacuation or in a weather event, there will be food there. What's wrong with that? Why wouldn't we want to prepare in that way? Why don't we have designated disaster routes whereby people can get out of town and advice for them where to go? Mandate that you have hand sanitizer at the entrance to every restaurant as you do on the Queen Mary. You don't get into the dining room on the Queen Mary without hand sanitizer. This was before the pandemic. This was because of Norwalk virus. You can't make people do it. Some people will do it and then rub their hands on the bottom of their shoes just because they like to be devilish. There have been people in this pandemic coughing on other people, spitting on other people. What are you going to do about that? It's pretty weird. And there are people who go around coughing on public railings and what have you. But I think that there is some academic literature that I've just been studying for this project of mine that says we need to rebalance the responsibility of government and of the individual. It's fine that the individual is empowered and sovereign and what have you. But what about the responsibility of government, who used our tax dollars to find out all this stuff and is then saying to us, well, do what you want or do what you think best? That's an abdication as far as I'm concerned.
Wendy, I'll turn it over to you. Thank
Sure.
you.
Yeah, Alan, I think you're right in terms of the abdication of the government's role. I was talking to clerks at the No Frills near my place, and here is like a 22-year-old grocery clerk who is enforcing 6-meter distance outside, enforcing the number of people in the shop, dealing with people at the cash who are getting yelled at all the time. And he said to me, like, why am I enforcing the government rules? So there's a lack of compliance from the general public yet on these new norms. And here's the guy who's usually stocking the lettuce who is getting yelled at for enforcing public health rules. And you multiply that by, I guess, every business. And you're right, we're all doing it differently.
Yeah, and you hit another nail on the head, Wendy, that I had missed, and that was the government has delegated this all the way down the line to the minimum wage grocery clerk standing at the door doing the best he or she can, which includes wearing a mask, and going, and you're not sure whether they're waving you to come in, asking you a question, telling you to get out, or what have you, and then there's an obscure handwritten sign saying line up over here. I mean, this is amateur hour. A quick story, a dear friend of mine had trained as a graphic artist with Walt Disney and knew Walt Disney. He's now passed on, but he was the manager of communication for Exxon for 34 years and helped develop the Exxon Energy Pavilion. I was touring a science museum in New York with him, and I said, what do you think of this, Ken? And he said, Disney does it better. I mean, if you want to know how to move crowds around and get people to go from there to over there and not get upset in line, it's Disney. When the lineup gets so long, out comes a little band or Mickey Mouse or some damn thing. That we can't have that all over our cities, but we should be far better in, even if we started from a standing stop in this pandemic, we should be far better at crowd control and those kind of safety measures. By the way, 20 years ago when I was working in Japan, you could buy beautiful hot coffee, cream and sugar, whatever it is you wanted, in a can on the street, opened it up, it was fresh and wonderful. And as far as I know, that's Canadian technology. We could have by now put dozens of such vending machines on our streets near coffee shops so that people don't actually have to go in them. So I'm not seeing all the creative solutions that we could engage in.
So the flip side of that is the public response to that, from uneven bylaw enforcement to lack of planning now in schools. We were talking just last week to a friend who is a high school principal who just got an email last week from the Ministry of Education. Could you start thinking about September and how you're going to handle crowds? We've got a few people with very interesting academic and government backgrounds and not-for-profit backgrounds here on this call. We should have a conversation about why is government so slow to start providing guidance, and what's missing?
Well, there's a documented phenomenon in crisis management, and we've probably all experienced it, and that's what's called activity traps. Researchers have documented people who, after an earthquake and their property is devastated, you couldn't possibly know which is the property line, they are picking up cigarette butts and pop cans because they feel like they're doing something useful, and they have what's called a short closure loop, and they say, well, I got some cleanup done. So my experience in crisis management is people have a tendency to sit around the room and ponder options and impediments to options, activities, this, that, and the other, but they don't actually take a decision, and they keep administering the thing. And this is taught at Harvard as well. This is a standard versus an objective. What is the objective for September? Well, let's decide and make that a standard. We need a certain number of cases or certain distance apart in order to reopen. In terms of education, here's where I've always said that distance education, online learning, is great planning for weather events or for regular flus. 50,000 students at York University, I mean, they're on top of each other in the library. You can be assured that if you teach a class there, you're going to get a cold or something. Well, we can do something about that with distance education. So all I can say is it's rigor mortis or activity traps, Wendy, that causes a delay in planning ahead for these sorts of things.
Well, Alan, I'm going to take us before we have about 7 minutes left into the lightning round, where anyone can ask a question, and then we'll come back to Wendy. I'm going to just kick it off very quickly with eventually governments are going to get back to real opposition parties and the blame game, and the communications is going to change. We may get the old Doug Ford back, we may get whomever. So very quickly, what does crisis management communications look like as we get back to regular politics?
Well, as we get back to regular politics, we won't be in crisis management and crisis communication anymore. That's sort of ipso facto QED, thus I have proven it. There will be inquiries. There could be a royal commission. There could be an all-parliamentary committee. There will be blame, but it will be after the fact. We're still debating NAFTA. We had the McDonald Royal Commission on jobs or whatever it was on, and recommended NAFTA. So, once we get back to normal, it's going to be back to normal with accusations in question period. And it may well be that Premier Ford is not a good normal time premier. He is a wartime premier. We'll find out.
Okay, so Anne Elizabeth, you had a question. You want me to just read it out, or why don't you ask it yourself as the next part?
I guess I can ask it myself. I guess I'm just really fascinated by this time. I mean, you were mentioning people kind of, by and large, a lot of people listened, even though the communication wasn't clear, to suggestions we should stay at home, take care of our neighbors. Like there's this incredible goodwill. There's a lot of discussion about, can we rebuild our economy in a more just way, all of this kind of stuff. And I'm very fascinated by, how do we take that sentiment to action? And I'm curious if you think that might be a communications problem that could be solved specifically.
Well, I think to turn your phrase around on you, I think communication can solve many problems. Take a couple of examples. The government official, with all great respect to all the highfalutin people Wendy hangs around with, but I mean, the government official that has the most contact with the most Canadians virtually on a daily basis is a postal worker. And in America, I don't know if you've done this, but I put on my GPS, where's the post office, and I find one about every 10 miles. I mean, every small town has a little post office. I don't know how they sustain it. I mean, as big a supporter of the government as I am, I would reduce mail delivery to 4 days a week and reduce postal stations to every 50 miles or something. So I think what that means is, if we are trying to check in on people and make sure older people are are not sweltering in the heat or not freezing in the cold or have enough to eat or aren't suffering from the pandemic. A postal worker just might be the person to do that with all the training and personal protective gear and so on that would be required. If there is some sort of a piece of kit like gloves or masks, or there's a medication that everybody should take, a postal worker can get it to you. And this is, in the crisis management business, this is called an expanding organization. They normally deliver mail, they can deliver a whole bunch of other things. Now, how you go about making the economy more just, that's difficult. I mean, we've had 50 years of redistribution of income in Canada as a matter of public policy and achieved almost nothing as far as the research that I've seen. The rich get rich, the poor get poor. There is a disparity. The differential between executive pay and worker pay is huge in North America versus in Europe or Japan. So that may be a bridge too far. But I think that the repurposing organization is a great idea. In our cities, if we need to move sick people around, we don't have enough ambulances, so we need to repurpose taxis. And way back, long before last fall, to capitalize on Wendy, I think it was either Wendy's or Rick's initial question, what could we have done? Had we been washing our hands, had we been looking after our immune systems and reducing diabetes and pre-existing conditions and so on, we would have been in a lot better shape for this pandemic. It is shown that the vast majority of people who are dying have some sort of pre-existing condition, including medication and so on. So, those are the top of mind thoughts on that topic. And I'm not sure how well we're going to do on that, but I hope we do better.
Yes. Are there any other questions from the group?
Sorry, I'm dating myself, but I think you were trying initially a question from Marcel Marceau, but
Yes, exactly.
you didn't finish it off.
Wendy, from my perspective, Alan, it's always great to get your insights. You're extremely well read, well researched, and your thoughts are always very clearly provided, and that's great to have you on this seminar. Wendy, I'll give it to you for some last.
Sure. Again, Al, thank you so much for your presentation today. It was really helpful and interesting, and a pleasure to have you speak to this group. And it could not have been more timely or thoughtful. So thank you again for helping us with this presentation.
Well, my pleasure. I'm pleased to make a contribution. I've received a lot of benefit from going to Harvard and from going to your events, so I'm happy to contribute to something. Thank you.
Thank you so much. And everybody, thank you for being on the call, and have a great weekend coming up. Be healthy, be safe, and as Alan says, wash your hands a lot.